What's up, you guys? It's your boy Miguel, giving you your daily dose of radiation. In today's video, we are covering the struggles of doing x-rays in the trauma room and the beloved emergency room. So to give you context, I am a night shift x-ray tech, been doing it for 4 years. And the traumas, the infamous Daniela Miller method, the infamous cross tables, and all the broken bones, right? So, the trauma room. In an ideal perfect situation, there would be a trauma bed. For those who are unfamiliar, trauma bed is when you place your beloved portable x-ray board underneath the gurney, the stretcher, whatever you want to call it, and you do not have to move the patient to perform any exams. Usually there'll be 2 slots, one on the top for chest or shoulder, whatever's going on, and one towards the lower, which you can shoot all the way to probably a lower tip fib. Sometimes it'll get clipped by the little metal railing at the bottom, so the lower extremities, or just move the patient up. So in a perfect situation, you would have the trauma bed. So occasionally you don't, because the nurses are busy rearranging, or there's so many traumas that the trauma bed is already occupied. At my hospital, there's very limited trauma beds available. I think we only have like 3, so it's not always ideal. So that's one of the biggest struggles, I guess. The next one is depending on what happened to the patient. If the patient is actively getting CPR, you will have to both fight with the nurses, both to place the thing, both to shoot and adjusting the tube. There's various things that will come into play to make it harder for you to be able to do your exam. Because a lot of the times the nurses are running in and out, or they're documenting, or they're trying to get IV, or they're trying to do their job, right? That's one of the biggest struggles we have. Once again, also exposure. Sometimes you'll have everything ready and you're ready to expose, and you'll be yelling, "Get x-rays, x-rays." Some of the nurses, they're cool with it. They'll take the dose. They'll tell you shoot it. It's okay. Other nurses, more of the younger ones, especially if I see more of a younger nurse or nursing students, I'll make sure that they heard me, and I'll double check before I shoot, because sometimes they're so busy, locked into their own job, to their own thing, they're not paying attention. That's another struggle we face. Sometimes, depending on how, even if it's a stretcher that has the trauma bed, sometimes depending on the placement of the patient, if he's too high or too low, the board will slide and it won't stay in place. You'll have that problem. Other times, if they're too low, the metal railings, sometimes you'll have to move the patient to get a better image, or other times you'll just have to adjust his feet. Now, depending on how big your board is, sometimes patients come in with broken bones, and it'll be like an open fracture and there'll be blood everywhere, or someone got shot. Sometimes you're able to put your x-ray board in a little patient bag, or some places have special x-ray board baggies, just so it makes it easier for you to clean and to avoid having blood and other bodily fluids on your x-ray board. So that will always help too. I would, the amount of traumas and stuff I've been in, I would recommend going with the purple wipe first, just to get the good amount of blood off, and then later on going with the bleach wipes. That's the most cleanest, effective way. And if there's certain blood, it just keep on nagging it with the little bleach wipes. That will help tremendously. Because I remember my first day that I was in a situation where there was a lot of blood on my board, I was kept on using the purple wipe, and I would wipe, and some of the blood and other stuff wouldn't go away until the other tech showed me with the bleach wipe. You got to be careful with that one, because that one will stain your clothes. So, what other struggles do we face? If your hospital is like mine and your beloved portables are not the most perfect, sometimes you'll run into the situation where you'll be offline, you'll have to quick start exams. sometimes that will happen. Other times your machine will kind of not be optimal and it won't want to shoot because it'll be like, so you'll get certain codes sometimes that like it overheats, or just struggles that every hospital faces. You'll have that occasionally. What other ones? You have to keep in mind when you're placing the board underneath the stretcher, and especially the trauma board, like the trauma stretcher, there is a good gap. So if anything is misaligned, it will be shut off when you shoot it. Like your tube, the angle to patient, it will kind of like, the SID will kind of throw it off, or the OID, I guess, the OID will throw off like the projection of where the image is going to land. So sometimes you have to kind of calculate for that, maybe adjust the tube or angle just to get it, because there's been many times where like your placement of the board looks good and then you'll shoot it and then you'll clip the top. Majority of the times most techs clip the top. That's what I've noticed. So if you angle down a little bit or slide the board a little bit up, you'll probably do pretty good. With the trauma rooms, they are being recorded at all times. Just a little advice for y'all. Be careful what you say, be careful what you do, just to keep you safe out there. I know sometimes certain people will talk, so that's just a little extra piece of bonus advice. What other struggles? I mean, a bunch of cross tables sometimes have to be done depending on how messed up the patients are. Sometimes you'll have to do what I call the double cross table, where like you'll cross table how you normally do, let's say a cross table with the femur. You'll do the regular cross table for the femur, for the upper, for the head, and then depending on how broken or what's going on with the other body parts, sometimes you'll have to cross table like internally some and externally some, like internal, external, medial, or it's weird. But you just, when you're cross tabling, just make sure you annotate to let the radiologist know how you shot it, because sometimes I'll be shooting stuff and I'm like, did I shoot this medial lateral, or did I shoot this axial lateral, or did you just make sure that when just put little notes, annotate on the image to make sure that the rad knows, and for the emergency room doctor knows. Some of the struggles also is, obviously, if someone's body part is broken, you're probably not going to get the best pictures, especially if they are actively awake and you're trying to manipulate or move or kind of try to doing stuff to the patient. Sometimes you're not going to get the best pictures. Sometimes you won't be able to get 3 views, you only get 2 views. There's been times, because the way that the bone is positioned and we try to hold to adjust. One time we shot an elbow that was both, all 3 views. It was both lateral, oblique, and AP, because the way his arm was broken and the way it was weird. It was all 3 in one pieces. So we had those are the times you had to think out the box of how to angle the tube so the body parts can look a little bit different and you get better angles for the rad. I have never been in a position, it's more of the ortho doctors. The ortho doctors are more picky on, even if it's broken, how to properly get better images. Some of them are a little bit more particular in that sense. But usually the emergency doctors, I mean, if it's broken and as long as you're able to get something, they can kind of work with it. It's more of the ortho doctors that are a little bit more picky on how they want their stuff, and they want it perfect, even though like you're still going to manipulate it and you're probably going to need more pain meds, because the patient will probably won't let you adjust them to get the picture. So yeah. Hope you find this informative. I'm here educating you on the beloved field of radiology. If you check out my channel, I post almost every single day. This cost me $0 to make. It was just the knowledge that I acquired, and I'm giving back to y'all, because when I was a student, I always wanted to know some of these stuff, and no one was making videos on them. So yeah, it's been your boy Miguel. See ya on the next one.